Now we're going to show you how to do the correct procedure on how to dilute HCG and do a subcutaneous HCG injection. Now, you are going to receive a vial of powder, which is the HCG, and they're also going to send you a vial of the bacteriostatic water. Basically, what we're trying to do is put some of this water into the vial of powder so we can dilute it. I'm going to take some alcohol, wipe the vials off with alcohol. They will typically provide you with a diluting needle and syringe. What we're going to do, and sometimes this is varying, so you're always going to want to make sure you check with your medical staff on exactly how many cc's you put into the vial of water or vial of powder. But we're going to use 3 cc's today because it is a 6,000 IU vial of HCG. You're going to put some air in the vial, pull the vial upside down, and as you can see, it pulls back on its own most of the time because it creates a vacuum. If it doesn't, you can pull back the rest of the way. So we've got 3 cc's or 3 mLs pulled up in the syringe. Now the trick here, when you're putting the water in the vial of powder, powder is very sensitive, so you don't want to jab the needle straight down. You want to go ahead and put it in at an angle so the water hits the side of the glass when it goes in. You push it in. Typically, again, it creates a vacuum and it pushes in itself. If it's not, that's fine. You just push the water in. Take the needle out. And again, the powder is very sensitive. So just swirl the vial in between your hands to dilute the powder. And usually the powder will be completely diluted. If you still see some specks of powder, just keep swirling it in between your hands. Once this is diluted, you want to make sure you refrigerate it after the injection. And this vial will be good until it is out in 6 weeks. Now we're going to show you the correct procedure on how to do an HCG injection, which is basically a subcutaneous injection. Always wipe the vial off with alcohol. And you are going to wipe the area that you're injecting with alcohol as well. For any subcutaneous injections that you do in the abdomen, and basically subcutaneous means into the fat. So usually you're going to go on either side of the belly button, and you can start changing sides as you do injections. So we're going to do the left side here. You're going to wipe with alcohol. Always let the area dry before you do an injection. It may make it sting a little bit more. So we're going to draw the medication up. Typically, and again, refer to your medical staff on your exact dosing, but as an example, we're going to do 500 IUs, which is up to the 50 on the insulin syringe. So again, I like to put air into the syringe. You're going to put the needle at a 90-degree angle, straight in to the plunger. Put the air in, put the vial upside down, and start drawing back on the plunger until you get to the 50. Now, the area we wiped off with alcohol, you're just going to pinch to get a little bit of the body fat, and you're going to put the needle in at a direct 90-degree angle. And then you're going to push the syringe in. And you're all set with the HCG injection.